More on women leadership during the crisis. I'm joined by Amy Batson from Seattle. Amy is the Executive Director of WomenLift Health, an organization that helps elevate women to become world health leaders. Thank you for joining me.
Thank you for having me.
So help us understand, why do women leaders seem to be winning the war against COVID-19?
Obviously, there are examples of great leaders who are both men and women. But while women leaders are leading less than 7% of countries around the world, this small group of women is having an outsized success in addressing the COVID pandemic. These women leaders are showing the world how collaboration, empathy, a focus on evidence, combined with decisiveness, are particularly effective right now. From New Zealand to Iceland to Bangladesh, women have been winning the war against COVID.
So then talk about the role of prioritizing investing in public and environmental health in the years leading up to the pandemic.
We reap what we sow. We did not invest in the underlying health systems, and that has hurt our ability to reach people and respond to the pandemic. COVID is showing us the vulnerable communities that we have overlooked for far too long. The reality is 70% of the health workforce are women, but I can guarantee you barely any women were around the table when those decisions about health were taken in the past. In fact, there's even data showing that when women are in a position of leadership, they're more likely to prioritize issues that have been sidelined, like clean water, sanitation, and stronger health care, all cornerstones for pandemic preparedness. At WomenLift Health, we're dedicated to supporting the women to become the leaders the world needs.
And we did see that New Zealand's Prime Minister was one of the first leaders to propose innovative ways to boost the economy, including a 4-day work week. Talk about other women leaders' original approaches to steer their countries through this health and financial turmoil.
Yeah, we've seen a number of female leaders who have taken bold, innovative steps to support their economies, like Peru's Finance Minister, Maria Antonieta Alba. She's negotiated a rather comprehensive recovery package for small business and individuals across her country with many elements that have never been tried in Peru before. In Norway, Prime Minister Erna Solberg has held press conference specifically for children to be able to answer their questions and help them and their families process what's been happening in the pandemic. These women have acted decisively, they've acted with empathy, and they weren't afraid to take the risk of doing something that was very untraditional.
Now, I want to turn to a phenomenon called the glass cliff. We see that in politics and in business, and it refers to this historical precedent of having women more likely to be given access to these leadership positions, but during a crisis when they're actually more likely to fail. Why does that tend to happen, and what message does that send?
Yeah, everyone knows the glass ceiling, which is the limit on women's advancement. This idea of the glass cliff, where women are more likely than men to be appointed to a leadership position that's precarious, that's in an unstable circumstance, like when a company is facing a big downturn or during a crisis, because there's a much greater risk of failure. We may be seeing this phenomenon play out here, but what's particularly exciting to see is that far from failing, we're seeing how effective these women are in leading through crisis. And this should be a stark reminder to the world that women's leadership is vital in times of crisis and in calm.
And we did see that the last time the world faced an economic crisis back in 2008. We saw that numerous studies suggest that countries and banks with more women in leadership roles actually suffered less. So in the years later, we saw more women on boards as well as in leadership roles. Do you think we're going to see a similar shift after this current pandemic?
You know, greater diversity leads to better decisions, and there's research showing that companies with leadership teams and boards that have a mix of men, women, people of different races, people with different backgrounds are more profitable. So while we don't know what the future holds, we do see that the world is paying attention to the value of having more women leaders. But we also see women leaders are struggling to manage their professional responsibilities while also having to pick up the majority of the family and the child care needs that are happening during this COVID period. So it's up to all of us to seize this moment for women and double down. We certainly can't let the pandemic undo years' worth of gender equality work. And that's why we're looking at WomenLift Health to see how do we usher in a new normal where women's leadership is the norm, not the exception. COVID has certainly reminded us all the world needs the best leaders, women and men.